This is breaking news from KETV Newswatch 7 and KETV.com. Good afternoon, I'm Julie Cornell. We have learned this afternoon that someone who attended 2 Creighton basketball games in the last week is positive for COVID-19. Now, we are standing by for a news conference from the Douglas County Health Director, Dr. Audie Poore, Omaha Mayor Gene Stothert, and others. You can see the news conference is set up there at the podium right now. This person apparently was out and about from March 2nd until March 11th and went to many places around town. They're saying the Walmart on 120th Street. He took a bus to the Creighton game against Georgetown, went to the Georgetown basketball game at the CHI Health Center, then a bar, another Walmart. The list really goes on and on. This person was at the Creighton Seton Hall basketball game, also at CHI Health. That was on March 7th. Barrio's Tavern, the Jackson Street Tavern, Drastic Plastic, and then Winchester's, 70th and Q. So this was all within a span of 10 days where there were public exposures. Now, we were just waiting for this news conference to begin. I can see that Governor Pete Ricketts is standing at the podium. I see county commissioners, I see the mayor, I even see the police chief there, and we're getting ready to start. We learned that Omaha had its first case of community transmitted COVID-19 just yesterday. Now, this was a woman who traveled to New York. Let's check in with the governor.
We, in our efforts to continue to make sure we keep you all updated with regard to the status of the coronavirus and its spread in our community, we're here today again to talk about some other cases. Dr. Poore will talk about that. We also are joined by numerous other folks. We've got county commissioners Duda, Boyle, Borgerson, Rogers, obviously Mayor Stothert, Dr. Gary Antone, who is the Chief Medical Officer for the state of Nebraska, Chief Schmatter, Chief Olson as well. So I will just remind folks that we have a great team here that is working very hard to keep people healthy and safe here in the state of Nebraska. You've got great public health officials. Dr. Poore and her team are working round the clock to trace the cases of coronavirus that we have, to find out where they're going in the community, and she's going to talk a little bit about that in a little bit more. I also want to remind people that yesterday we had our first case where we could not track where that person came from. And so this is our first case of what we call community spread. And as I mentioned on Friday, and put out that guidance, and you can find that guidance on governor.nebraska.gov, if we have 2 cases in Omaha, that would prompt me to work with public health officials and the school districts to start closing schools. And right now we've got a document out that says we don't want any public gatherings greater than 250. We will be taking that down to 50 or less. So that's what will prompt when we have those 2 community cases. So we're continuing to evaluate that with your public health officials, and we're continuing to work to make sure we're keeping Nebraskans safe. So we'll have Dr. Poore speak. Then I think we're going to turn it over to Chris Rogers right behind me here. Then we're going to have the mayor speak, and then we'll open up to questions and answers. So with that, Dr. Poore, I'll turn it over to you.
Good afternoon, and thank you all. And as you can imagine, our epidemiologists have worked around the clock. And as I have told you yesterday, we had just heard about another case, but we hadn't had the history of that individual. We hadn't been able to track now wherever she has attended. This morning, early this morning, they indicated to me that this individual has really been identified, had tested on the March 13. However, her symptoms started on March 2nd. This was also a travel-related case. However, because she had these days in between, this individual was in our community at large public events. The question was asked yesterday, when we investigate those individuals, sometimes they are at few places, and we can identify and get information on their contacts. We then inform those contacts and let them know. In this event this morning, we won't be able to do that. There are events we have been able to contact individuals, like where she worked and so on, but there are more public events, and I think that's why we need you here, to really let the public know that if they have attended these events, they need to take proper precautions. And what do we mean by that? We mean they monitor their symptoms. They monitor to see if they develop fever, cough, fatigue, sore throat. And if they do that, they then contact their healthcare provider, telling them that they were in contact with a case, they were at the same place where the case was. Hopefully, what the healthcare provider is going to do, he may say, well, it sounds like you have the flu, and just so to let you all know, we have now more than 6,400 cases of flu this season. We had 2 pediatric deaths, and we have 9 adult deaths from flu. So influenza is still serious, and it's still going on in our community. The symptoms of influenza and COVID-19 are very similar. So the healthcare provider may say, well, we want you to do an influenza test, and he may do that first. That test comes negative, he may say, well, we'll do a respiratory panel. Only when that panel comes back, if he chooses to, he then will do a COVID-19 test. So just again, these are low exposures potentially, but as you can see, and I think you have the handout there, the events are really large public events, and I just go through a few of them. March 2nd, Walmart on 120th Street from 11 to 7 p.m. March 3rd at Walmart on 180th and Wright from 11 to 7. March 4th, Walmart on 120th Street from 11 to 7. Then on the bus from Barrett's Barley Corn Pub and Grill at 43rd and Leavenworth to the Creighton basketball game against Georgetown. Then at the Creighton-Georgetown basketball game at CHI Health Center. Same day at Patty McCown's 45th and Center after the game from 9:30 to 11:30. At Walmart at 168 and West Maple from 11 to 8 p.m. Let me just clarify, this is now 2 individuals that we have in Douglas County that were at these events. So you may see some overlap. This is not one individual. We are combining 2 individuals. March 5th, Walmart at 113th and Wickersham Boulevard in Gretna from 10 to 8 p.m. March 6th at the Walmart at 168 and West Maple from 11 to 8. March 7, Walmart at 168 and West Maple from 11 to 5. At the Creighton Seton Hall basketball game at CHI on March 7. Following the game in Omaha's Old Market at the Stadium Club from 4 to 5. Barrio's Tavern from 5 to 6. Jackson Street Tavern from 6 to 7. Drastic Plastic inside the Monster Club from 7 to 9. And then it is also possible that there are some random bars later that night. Another potential site is Winchester's at 70th and Q from 9 p.m. until 1 a.m. On March 10, the outdoor patio at the Kona Grill in Village Point from 5 to 9. On Wednesday, March 11, Walgreens on 24th and L from 1:30 to 2. Hy-Vee on 50th and Center from 5 to 5:30. March 12, the Walmart at 168 and West Maple from 11 to 1:30 and from 9 to 10 p.m. Again, all these are considered low-level exposures. But if you were in these locations during the time, we are asking the public to monitor for symptoms. Again, symptoms, fever, cough, sore throat, or difficulty breathing. If you have COVID-19 symptoms, as I said before, you contact your healthcare provider. We have an information line, 444-3400, that is answered during the week from 8:30 to 4 p.m. And we have 211 as our backup on the weekends and after hours. Again, I just want to share with you, we are open and want to be as transparent as we can be in these circumstances to let the public know the status of COVID-19 in Douglas County. With that, I think I'm going
Commissioner Rogers.
go to Commissioner.
Good afternoon. Chris Rogers in this role, President of the Douglas County Board of Health. So as Dr. Poore mentioned, because of the individuals broad exposure to a lot of these big events. We've been in conversation with the mayor, the chief, the fire chief, and other relevant bodies to have some discussion about the possibility of limiting crowd size. So at this point, everybody needs to be clear and to be on notice, particularly with St. Patrick's Day coming up, that we are having some strong discussions and very likely to exercise powers in Douglas County to be able to limit crowd sizes to below 50. Well, we'll let people talk about the exact number, but basically, bar owners, it's not referring to businesses per se, but particularly entertainment gatherings, things of that sort. The public needs to be on notice that we are definitely having conversations and could likely pull the trigger to limit crowd sizes because of this fact and the big exposure. So with that, I'd like to turn it over to the mayor.
Thank you all. Again, I want to reassure people, you are in good hands in Omaha, Nebraska, with the expertise at DHHS, with the state, our physicians on the state, our chief medical officer, with the experts we have in our biocontainment lab and in UNMC, our experts in the city of Omaha with epidemiology and infectious disease and communicable diseases, Dr. Poor with Douglas County. They are our experts, and you are in good hands. And we were here yesterday with a press conference. We may be here tomorrow with a press conference because things change rapidly. What we were saying yesterday, a lot has changed today. And so we will keep you informed, but still, as Dr. Poor said, most of these cases that have been diagnosed and test positive, they have mild symptoms. I do want to say, too, I don't think that you will find anywhere in the United States a more engaged, hands-on governor as we have in the state of Nebraska with Governor Ricketts. He has been, I know, spending about 24/7 right now on this, and his goal, as well as all of our goals, are to reduce the spread and reduce the number of people that become infected and test positive. I agree wholeheartely with what Commissioner I said all these people's names and forgot. Sorry. What Commissioner Rogers just said. Governor, with his declaration last week of a state of emergency, he has restricted in his orders public mass gatherings to 250 people or less. He did say that if there are 2 cases that test positive that aren't travel related, that number will go down to 25 to 50 in mass public gatherings. We are talking about, and I agree with Commissioner Rogers, that maybe it's time for us to use our powers now with the holiday, St. Patrick's Day coming on, and with all of the events that we know are going to be held in our bars and in our restaurants, to go ahead and reduce that number. We haven't made that decision yet, but we want to make the announcement now so that bar owners and restaurant owners are aware that we may reduce the number to 25 to 50 in these closed establishments. I have a great concern about the people that will be there, the close contact. I know we've talked over and over and over again about that personal contact and that distancing. I also am very concerned about our first responders, our police department that would have to enforce these rules going into these bars, and of course our medics and paramedics who are transporting patients. So those are first and foremost my concern too. So we will discuss it. We will make an announcement probably tomorrow about that, but I think it's very important that we announce that tonight. Along with our efforts to control the spread, I want to announce tonight that as of tomorrow morning, we will be closing all of our public libraries and all of our community centers. I think that that is very important, specifically in our community centers, because who goes there the most are the elderly. And that is who we are trying to protect the most. Now, in our community centers, there's no doubt a lot of times that they go there for their meals, and we'll be working on to see if they could have Meals on Wheels to continue to provide food for them at home. But I think if this indeed is what we are trying to do, is to prevent the spread, and especially those that are most vulnerable, our elderlies, it is the time right now that we close our public libraries and our community centers until further notice. What we will do first with our libraries and community centers, though, is deep clean them. The housekeeping that we have in there is basically dusting and vacuuming, and they are not deep cleaned. And when you think about all of our libraries, with all of the computers people go in there and use, all the keypads, the screens, everything in there, I think it's very important that we take the step right now. As of tomorrow morning, they will not be open, and next week we'll spend the week deep cleaning them. And again, this is for people's safety and to prevent the spread. So with that, I would like to open it up for your questions. You can ask a question of anybody up here, and please address who you would like to direct your question to.
Mayor, is there any chance on St. Patrick's Day that you're going to ask bars and restaurants to simply close?
You know, Joe, it changes every single day. If we get a lot more information tomorrow, I will certainly discuss with the governor. I'll discuss with Dr. Poore and the county board, and we will make that decision. It is a possibility.
As you know, Illinois has closed its bars. Its governor decided to close its bars. Governor, what about Nebraska? Do you think we should be proactive, given many thousand people who were?
Well, as the mayor said, she and Commissioner Rogers are going to be in discussions with that. We'll be a part of those discussions as well, so we're going to continue to consult. I think the mayor made a good point. The situation changes as we get more information, so it's under consideration, and we'll, again, let everybody know if we decide to take it to that next step.
Mayor Stothert, knowing obviously the population differences in Omaha compared to the rest of the state, is there any possibility you would make that decision specifically for the city of Omaha or Douglas County in the case of Commissioner Rogers, outside of the state's?
Right. And if we make that decision, it would be for Douglas County.
Specifically Douglas County?
Yes, absolutely.
Are you considering closing restaurants and bars completely, or doing takeout from restaurants? I mean, what will that affect people's access to food?
You know, the question was just asked to something similar. Right now, what we are talking about is restricting in places, public places where people gather. Right now, it's 250, according to the governor's orders, and we may go ahead and take the steps to reduce that to 25 to 50, just because our whole goal is to help prevent the spread. Now, I will say this, I spent yesterday going to quite a few grocery stores and restaurants in town just to see myself how it was affecting, and there are still people in the grocery stores, there are still people in the restaurants, but what I have seen is a lot less than what I usually see.
Mayor?
And again, I hope that is because people voluntarily will do that. You know, I do see Nebraskans and Omahans as very responsible people, and we are trying to keep them informed all the time as things change. But we hope that they, again, will not panic, but will be very responsible and be responsible on their own. So far, we've seen a lot with the St. Patrick's Day Parade. We've seen it with the fish fries. We've seen it with Omaha Public Schools, that people are taking that initiative without being ordered to do so. And there's, today, thank you, and today the zoo. You know, the zoo made the announcement today that as of tomorrow, the zoo will not be open, all for the same reasons.
Mayor, what factors do you need to see to make that decision?
Well, I think it's based on the standard and the order that the governor has made with his order for a state of emergency. He has set the criteria in his conversations and his meetings with the state experts on epidemiology and infectious disease. They have made the criteria at 2 or more diagnosed within an ESU, as far as the school goes, that are unrelated to travel. And if it gets to that 2, then he announced that the schools will be closed for 6 to 8 weeks, and then there are other measures that we would be taking. But what we are saying right now is maybe it's time not to wait for that second one. Especially with St. Patrick's Day coming up, and we know how people assemble in our bars here.
How difficult is it going to be to enforce these limited crowds and possibly the closures?
Well, you know, I think a closure, if we mandate that they're closed, I don't think it's as difficult as we limit the number of people. Because again, if the order comes from the governor or the order comes from Dr. Adi Poore with the Douglas County, it would be up to our Omaha Police Department to help enforce these things. And so I'm concerned with them too.
What penalty will there be if somebody exceeds the limit of people in their business or a larger gathering?
You know what? I'm probably not the expert to answer that one.
Tom, I don't know what the specific penalty would be as well. I can tell you if you go back and look at what happened, for example, during the Spanish flu pandemic 100 years ago, people were arrested for violating the ban.
I mean, Chief, do you know have you advised your officers how you guys would handle that?
First of all, good evening, everyone. The Omaha Police Department, in the event that we were to enforce the ban, 250 or less or 50 or less, the reason we're tentatively talking about that now is so not to spring it upon our entertainment districts, our bar owners, if we do have to do that down the road tomorrow or even somewhere in between. So that's the reason for that. The progression would be this: the Omaha Police Department would respond. We would get with the bar owner. We'd make an assessment of where the staffing and where is the number of people inside that building. Let's get a gauge of where we're at. If we determine it's over, we'll work with the bar owner to get them in compliance, or we can take the measures to shut it down. That would accompany a tavern report, and would also accompany some type of criminal action. What that is at this point, we're still looking at some of the basic tenets of that, but that would be the progression the Omaha Police Department would do to enforce this lawful order.
Chief, have you talked to the union? How eager are your police officers to go into a bar with drunk patrons and try to rouse them out?
That's a interestingly worded question.
I've been in those bars. I've seen it.
The Omaha Police Department's well-versed at interacting in the Old Market area, the Blackstone area, all our entertainment districts. We actually enjoy interacting in those environments. It's an area we're very used to policing in, and we would be accustomed to handling this lawful order when and if it is imposed.
Mayor, you may have answered this in the days or weeks that have already happened, but with more people maybe having to stay at home for a couple weeks and not being able to work, a lot of people won't be able to afford that. Has the city discussed anything that can be done to maybe bring some relief to people that are going to have a really tough couple of weeks?
You know, we absolutely have, and I will tell you, I think every business in Omaha is doing the same. I have been in conversations all weekend with our finance department, our law department, and our HR department. We will have a press conference tomorrow in my office at 11:30, and we are going to be making a lot more announcements about the city employees and the city staff. And so that will come tomorrow a little bit more. There's some other things that we have to work out right now, but I will say this, it is very important to us. You know, I think absenteeism is our biggest threat. Absenteeism with our police and fire department is of a huge concern. But again, our goal is to reduce the spread. And so we are looking at, you know, if we have full-time staff, if they are infected, test positive, if they need to stay at home and take care of somebody, if they have symptoms. We've already sent multiple letters out to our entire staff. Fire chief, police chief have done the same thing, saying if you're sick, stay home, and spelling out the criteria of using sick leave or leaving paid time off. We've already done that, but we're looking at expanding some information tomorrow about staff, and especially about our part-time staff. You know, typically part-time staff does not get benefits, so they do not get paid time off. They do not get sick time. We have over 700 part-time employees in the city of Omaha. In the libraries and community centers alone, we have about 350 part-time employees. So that is a big concern of mine, and that is something that we hope that we'll be able to talk more about tomorrow.
Governor, should the other communities in the metropolitan area be looking at these similar measures? I mean, if you're in Gretna or these other communities, should they be doing this?
I think that makes good common sense. That I think what the mayor and the commissioners here are talking about are common sense measures specifically about trying to limit the spread of coronavirus. And I think other communities can do the same thing. They should be taking a look at what are the events they have in their communities and what can they do to make sure they're limiting the spread of the virus. And similarly with what I was talking about with school districts on Friday, where some school districts have made decisions, for example, like OPS did, to close this upcoming week. I support the decision of those local decision makers if they want to do something that's more conservative, they want to go beyond the guidelines that I have put out there.
I have a question about food insecurity. In my North Omaha neighborhood, people are acutely concerned about children who normally get their only hot meal at lunch at school. What is the state and perhaps the city or county doing to support our nonprofits? So that, and when will people know precise details on what they can do to get food and how these kids, what can be done to feed these kids?
Well, specifically with regard to food insecure kids, that is something that's being handled at the school level. Dr. Cheryl Logan mentioned this on the press conference on Friday, that OPS, for example, is putting plans in place to be able to do that. They're looking at repurposing, for example, some of their staff to be able to maybe deliver. They're looking at backpacks, that sort of thing. So really how that is being affected is through the school districts. One of the things we also would encourage is private sector folks to look and work with their food banks and pantries and so forth about what they can do there as well to help individuals who are not going to fall in that category of kids who are going to school. So I think this is, again, an opportunity where we all as a community have to work together to be able to make sure we're taking care of the people who are going to be impacted by this.
I'd like to make another, can I make another point on that? I have been contacted by our philanthropic community last week. They have gathered and have met, and that is exactly one of the things that they want to address. Not only food, but rent, mortgage payments, other things that can be affected when people are not working and don't get any income. I will tell you that right now that they are temporarily putting their dollars that are being donated into the Omaha Community Fund. Anybody can go online right now and donate to that fund, and then they will do that until they create their own fund. And so our philanthropic community, our very generous donors that we have in this community is really engaged in this, and they want to put their dollars where it will help the most right now. I will tell you, and she told me today she didn't mind if anyone knows this, but talking to Susie Buffett, for example, with Sherwood Foundation, she has been exposed, and so she is in self-isolation right now at home. So it affects the whole community, but there's so many people can do from home and do on their computers. When the governor talked about the Spanish flu many, many years ago, what was that, in 1918, I think? We didn't have the technology that we have today. So much can still be done as far as governmental operations, as far as the fundraising can be done online and can be done even while people are in isolation.
Is her dad exposed? Everybody's going to want to know.
I do not know. I talked to, Warren Buffett called me a week ago Monday, and we talked on the phone for a while about Berkshire Hathaway, but he gave me no indication that he's been exposed.
Has she been tested?
I don't know that. I don't know that.
So let me add a point on this deal. So you made a point about the North Omaha specifically. So there's a group of community leaders and some other local elected officials that represent the North area that have had this conversation Thursday. So we've been on the string since Friday, and I've been in communication with Dr. Poore about that. And one of the points she brought out yesterday, which I think is to reiterate today, is and I think Commissioner Borgson made it yesterday, is the importance of the neighborhood networks, those other community groups to stay touched. So there's been a conversation out north about how to address those vulnerable populations and how to make those connections in the communication piece. So just to your specific part about that, that's some work.
Dr. Poore, can you give us an update on the number of tests available? Do we have enough?
I'm going to let Dr. Anton talk about it.
Now's your time.
I was waiting for that one. I can reassure you, Dr. Poore's team here, and Sarah Schramm's team in Sarpy County, and Justin here as the representative for the Douglas County Health Department, have been working almost around the clock on their epidemiological studies. So these two patients that Dr. Poore was talking about today, their close contacts have been identified. They'll go into self-quarantine and be monitored. I don't know, Justin, if you've had a time to talk to everybody that went to the Creighton games yet. I heard it was fairly well attended. My son decided to take his wife rather than me, but I heard it was. The good news is that a little over 2 weeks ago, we had our index case with a large amount of people at the facility in the YMCA. And so far, we have had nobody test positive that I know of, Dr. Poore. One patient, yeah. Just one. So that's the good news. I talked to all the CMOs and some of the CEOs of the major hospital systems, all the major hospital systems here in Omaha and Lincoln, and they assure me at this time that we have the capability to test who needs to be tested. We're still going to use the same criteria that we have been using: close contacts with positive tested cases, people in the hospital that are ill for without a reason with pneumonias, and then people that have traveled back to the area, that have traveled from high-risk area that have symptoms. The good news is, from yesterday's press conference, I have found out that the test kits that are used for getting the swab and into the viral media are the same test kits that are used to do what's called a respiratory viral panel that all hospital and most clinics have at least an adequate supply of right now to do the test. The rate limiting step was obviously the number of tests we could do here at the UNMC lab and at the public health lab, but now the commercial labs are up and running, and even, I think we're assured this following week will even be better equipped to start doing the testing we need to do. So I can just assure that if a Nebraskan needs a test, we will make sure that gets done. We asked them if they're sick, however, with symptoms, to stay at home until they're getting a hold of their healthcare provider or one of the local health department people. So that's the best way I can answer that question.
If I could just jump in here for a second as well. So I think one of the other reasons why Dr. Poor wanted to make sure that we listed out all the different places where one of the people who have tested positive for coronavirus went is because as you're going through this screening process, if you have that contact, that's one of the things that healthcare providers will ask. So for example, the Dr. Poor's point, we still have flu is way more prevalent in our city right now than coronavirus, okay? So the first thing a provider is going to do is test for influenza A and influenza B, and then they're going to do the respiratory panel. But if you are one of those people who have had a close contact, that's part of the screening process to know, okay, if you've had a close contact with somebody who's tested positive for coronavirus, that then is another part of the screening thing. Again, so if you were at that Walmart, for example, you should tell your healthcare provider, because they will use that to make that decision as to, should you get that test for coronavirus. So that's one of the reasons why we're talking about this right now.
Last question.
What are we defining as a close contact?
So, for right now, again, I would say if you've been to that Walmart, if you've been to any of those other events that Dr. Poor mentioned, that you should mention that to your healthcare provider when you go in. If you develop symptoms, so again, we want people to monitor their health. So if you were at that Walmart, if you were at that Creighton game, and you develop symptoms, contact your healthcare provider, let them know you were at one of those places, because that's part of the screen. Now, they're still going to ask you, do you have a fever? Do you have a cough? Are you having trouble breathing? They're going to do the influenza A and B tests, the respiratory panel that Dr. Antone was talking about. But if you get through those and those come out negative, what they're going to do is then say, okay, you have exposure, you're a higher risk, we'll then do that coronavirus test. So that's really the process we want people to go through, and that way we can really prioritize the people who are at greater risk at actually testing positive for coronavirus.
Governor, would you consider...
you're breaking the rules. Chris already said one more question. That was the last one.
Okay, well, I'm not really good with rules. Would you consider limiting or putting the unicameral on recess, an extended recess, until this blows over?
Well, Speaker Scheer and I are in close communication with regard to the unicameral. It really is a legislative branch decision with regard to that, because they are a separate branch of government, separate from the executive branch, but we're in close communication with regard to when the appropriate time to do that is. And again, I just want to point out, we have no community spread cases, none of those cases like we have here in Omaha, we have none of those in Lincoln. So it's a different ballgame right now between Lincoln and Omaha right now. Again, folks, thank you very much for coming out here today. We appreciate it. We will continue to keep you updated. I think you can continue to expect to hear more from the mayor, the commissioners, myself, as we go forward into this week. So I'm sure we'll all be very busy going forward. Thank you.